21, 22, 23, 24.
Two rescuer CPR is more efficient than one rescuer CPR. Good communication is vital when two rescuers give CPR together. Notice how these rescuers communicate as they work together.
1,000, 1,000.
As Rescuer 1 looks for movement and checks for breathing and a pulse, Rescuer 2 waits at the victim's side for further instruction.
1,000. No pulse, begin CPR.
Rescuer 2 quickly moves into place by positioning her hands on the center of the victim's chest and gives 30 compressions.
13 and 14 and 15 and 16 and 17 and 18 and 19.
Counting out loud helps rescuers work together.
24, 25, 26, 27, 28, 29.
After 30 compressions, Rescuer 1 gives 2 rescue breaths. Each breath should last about 1 second. Both rescuers continue in these positions, one giving compressions and the other giving breaths until they complete about 2 minutes of CPR. After 2 minutes, the rescuers change positions. Rescuer 2 calls for a change on the 30th compression at the end of the 2 minutes. After the 2 rescue breaths are given, Rescuer 1 removes his resuscitation mask and Rescuer 2 moves to the victim's head to give rescue breaths.
11, 12.
Rescuer 1 moves into position and gives compressions, while Rescuer 2 maintains the airway and gives rescue breaths, using her own resuscitation mask.
6, 7.
Changing positions should take less than 5 seconds. If at any time either rescuer notices any obvious signs of life, announce the command to stop CPR and monitor the victim's ABCs.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13.
Two rescuer CPR for a child follows the same steps as for an adult, except that when two rescuers are working together on a child, the compression cycle changes to 15 compressions and 2 breaths. Changing positions is also the same for a child, except that the rescuer who is giving compressions calls for a change on the 15th compression at the end of the 2 minutes. Rescuer 1 removes his resuscitation mask, and Rescuer 2 moves to the victim's head to give rescue breaths.
3 and 4 and 5 and 6 and 7.
Rescuer
and 8
1
and
moves
9
into position
10, 11,
and gives
12,
compressions.
13, 14.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and
2
11
rescuers
and 12
giving
and 13
CPR
and
to an
14 and
infant should use the 2 thumbs encircling hands technique. Place a towel or other padding under the infant's shoulders to support the shoulders and help keep the airway in a neutral position. To give compressions, place both hands around the infant's chest, supporting the back with your fingers. Place your thumbs next to each other on the center of the infant's chest just below the nipple line, making sure not to compress the lower end of the chest. Make sure your hands do not squeeze the infant's sides, chest, or torso. Use both thumbs to compress the chest about 1/2 to 1 inch. Give 15 compressions.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11.
The second rescuer maintains the open airway and gives rescue breaths.
1 and 2
The compression rate is the same for all victims, at least 100 compressions per minute.
And 12 and 13 and 14 and 15.
But when there are 2 rescuers, the cycle for an infant, like a child, becomes 15 compressions followed by 2 rescue breaths.
9 and 10 and 11 and 12 and 13.
The up and down motion of the compression should be smooth. Allow the chest to come all the way back up before pressing down again. Take the pressure off the chest without taking your thumbs off the chest. The position change for an infant works the same way as for a child. Change positions about every 2 minutes. The rescuer who is giving compressions calls for a change on the 15th compression at the end of the 2 minutes.
And 11 and 12 and 13 and 14 and change.
To review,
24, 25, 26, 27, 28.
when 2 rescuers work together to give CPR, one rescuer gives compressions, while the other maintains the airway and gives rescue breaths.
4 and 5 and 6 and 7.
Change positions about every 2 minutes.
2, 3,
Communicate with your partner to ensure a smooth change.
10 and 11 and 12 and 13 and 14.
2 rescuer CPR for a child follows the same steps as for an adult. But for a child, give 15 compressions and 2 rescue breaths in each cycle. Change positions every 2 minutes.
13 and 14 and 15.
1 and 2 and 3 and 4 and 5 and 6 and
2
7
rescuers
and 8
giving
and 9
CPR
and
to an
10 and
infant
11
should
and
use
12
the
and
2
13
thumbs
and 14 and
encircling
15.
hands technique. Give 15 compressions and 2
1
rescue
and 2
breaths
and
in
3
each
and 4
cycle
and 5
and change
and 6
positions
and
every
7
2
and 8
minutes.
and 9 and 10 and
Changing
11 and
positions
12
should take
and
less
13
than
and
5
14 and
seconds.
change.